Hello, class. This is Quiz 4 Review covering chapters 3, 4, and 8. The female external genital structures are known as the vulva. The vulva is composed of the mons veneris, which is called the mound of love, the labia majora, labia minora, the clitoris, clitoral hood, vestibule, urethral opening, urethra, introitus, perineum, and the anus is not part of the vulva, but it's part of the external structures. The lower illustration shows the variations of the way in which the vulva looks on different women. This cultural practice involving pubescent females can cause severe bleeding, intense pain, infection, childbirth complications, and death. We're, of course, talking about female genital mutilation, which is a violation of human rights. This form of exercise strengthens the pelvic floor for both males and females. Those are Kegel exercises. For women, Benoit balls can do the trick. However, both sexes can intermittently disrupt their urine flow for 3 to 5 seconds at a time to strengthen this area. Maria is scheduled for a hysterectomy. Her physician advises her that the surgical team will keep her ovaries intact to reduce her risk of developing breast cancer following the surgery. Okay. Christina has several of the listed risk factors: age, mutations of the BRCA1 or BRCA2 genes, reproductive history, dense breasts, personal or family history, early onset of menstruation and or exposure to radiation or the drug diethylstilbestrol or DES. Christina should schedule a mammogram or a mammography and conduct regular breast self-exams at home. The fringe-like projections at the end of each fallopian tube are called the fimbriae. The fimbriae sweep the unfertilized ovum along the fallopian tubes into the uterus for fertilization. Many women are hesitant to perform this exam because they think their genitals as part of their bodies that should not be touched. We're talking about female genital self-exams. When this small raised erogenous area is stimulated, it can trigger strong arousal and intense orgasm, finishing with a female ejaculate that is chemically like a male prostate secretions. That is the Grafenberg or G-spot. Here's a bit of information about the G-spot. Dr. Beverly Whipple reinvigorated research on the G-spot. She was encouraged to name it the Whipple tickle because of her research, but instead she paid homage to Dr. Ernest Grafenberg's initial work. This layer of connected tissue is a muscle that regulates the internal temperature of the scrotum. That is the tunica dartos, also called the dartos fascia, or simply dartos. The vas deferens, epididymis, seminiferous tubules, and the cremasteric muscle are all structures belonging to the testes. Which male external reproductive structures contain the most nerve endings? Are we talking about the foreskin, the glands, the shaft, or the root? That would be, as illustrated here, that would be the glands. The glands is filled with many, many nerve endings. Okay. Dan is scheduled for a vasectomy. The physician informs Dan that during the procedure, the vas deferens will be cut, tied, and burned. A sperm, the vas deferens is a sperm carrying tube that begins at the testes and ends at the urethra. Sperm maturing in the epididymis eventually drains into the vas deferens. The seminal vesicles produces 70% of semen in an ejaculate. The seminal vesicles is a small gland adjacent to the vas deferens terminals and secretes an alkaline fluid that assists sperm motility. Edward becomes intensely aroused, anticipating intimacy with his college sweetheart. When they embrace, clear droplets are released from the glands of his penis that contain active sperm. Which male reproductive structure releases this fluid? That would be the Cowper's gland. And again, the Cowper's gland is a pea-sized gland located alongside the urethra. The prostate gland is located at the base of the bladder and secretes about 30% of the seminal fluid released during an ejaculation. This procedure should be performed after a hot shower as an early detection of penile or testicular cancer. A small hard lump on the shaft or the testicles may be an indicator that he should make an appointment with a urologist. The procedure that we're talking about is male genital self-exam. I want you to be mindful that testicles are never the same size, so asymmetry is not a sign of cancer risk. Okay. All parts of the body are possibilities for kissing. Kissing can be more intimate than sex. Open mouth, deep or French kisses are usually more intense and generate sexual feelings. Closed mouth kisses are more affectionate. The Kama Sutra's manual describes 17 kisses. The accumulation of blood in the three sponge-like tissues, one being the corpus spongiosum, and two are the corpora cavernosa, are more commonly known as the corpus cavernosum, are collectively responsible for male erection. The capacity for erections is present at birth in males. During the emission phase, fluid pools in the urethral bulb, triggering the point of no return, also called ejaculatory inevitability. Genetics and hormones are the main determinants of penis size. Research indicates that there is no universal ideal penis size. Oral stimulation of the penis and the surrounding structures is referred to as fellatio. This includes, the surrounding structures include the frenulum, the shaft, the glands, of course, and the scrotum. Oral stimulation of the female genitals and the surrounding structures describes cunnilingus? Cunnilingus would include the clitoris, the labia majora, the vestibule, and the vaginal opening. During the Victorian era, some women chose celibacy to preserve their political autonomy, circumvent the constraints associated with marriage and motherhood, or pursue educational opportunities, including joining a religious community, such as a monastery. Individuals have the option to practice celibacy either partially or entirely or completely. Involuntary orgasm during sleep describes nocturnal orgasm. Both sexes experience nocturnal orgasms. A man's ejaculation is evidence that a wet dream has occurred. The evidence isn't as quickly determined for women, however. In Tantra, the male learns to control and delay his orgasm and redirect the sexual energy throughout his and his partner's body. All right, and lastly, review the male and the female sexual anatomy film clips that are in, I guess that would be module 3, to answer the extra credit question. And the films or the clips are they are facilitated by Dr. Mike. All right. Good luck on your test. And I will be talking to you all very, very soon.